name's Michelle and I'm going to be your student nurse today. It says here that we have an order to put in an IV, okay? Have you ever had an IV put in? She says yes. Any complications with that? She says no. Any allergies, especially to iodine or any other cleansing agents? She says no, just morphine. And then can I have your name and date of birth? She says Mary Smith, 5/18/63, and that matches the MAR and the band. All right. So what we're going to do today, we're going to put that IV in like I said, and then the needle will go in so you'll feel a little poke, and then there's a little plastic catheter. That's what stays in your arm. The needle does not, so you don't have to worry about that. And then once it's in, we'll give you some fluids, okay? So I'm just going to get some supplies ready here. So I've got bugs, syringe. All right. Is this arm okay, your right arm? She says yes. All right. I'm just going to put this tourniquet on to find a good vein that I like. We want one that's nice and straight. All right, put the tourniquet on, not restricting any arterial blood flow, making sure she still has a radial pulse. All right, I like this one here. It's nice and straight. And we want the puncture site distal to any joints. And if I wouldn't be able to find a vein, we want it nice and flat. But if I couldn't find one, I'd have her clench her fists and open and close it, or I'd apply heat for about 10 to 15 minutes. So I'll take this off, because we only want it on for about 2 minutes. All right, I'm just gonna get some supplies ready here. This is sterile, so we don't have to worry about that. Push and turn. All right, it's not locked at all. Make sure we get all the air out. Alright, gently put this cover back on. Set this up here. Tourniquet on, 15 to 20 centimeters above the site. Gloves on. Alright, we'll get your skin cleaned here, Mary. We're going to cleanse the site in outward motions, going circular. Covering everything that the dressing will be under, not touching it. Okay, wait for that to dry. Alright, that looks nice and dry. Alright, we're gonna go with the bevel up at about a 15 to 30 degree angle. I'm gonna pull the skin taut. All right, little poke here, Mary. Go until we see the flash. Yep. Then go almost parallel and go about half a centimeter more. And we'll advance the catheter in. Still not touching her skin. And flush this. Any burning at all? Nope. A few millimeters. Lock this. Take down to secure it. Lock that. Dressing on. Sure that's secure. All right. I would wash my hands again. And then dispose of all my supplies in the appropriate area, the needle and the sharps. And I'd clean up after myself in here, get this towel off. I would make sure to document. And then first I make sure my patient is safe, so make sure the bed's low, the railings are up, that the patient is comfortable, they have their call light. And then I make sure to document and write on here my name and date on the site. And then I would document in the computer the location, the gauge of the catheter, the type of needle used, the date, the time, how the patient reacted, their response,